Well, good evening. Good evening. God bless you. Welcome, welcome, welcome. You are watching Gretchen Dixon Let's Chat, aka Fatal Distractions Let's Chat. We had such a powerful, powerful discussion last week. Had so many requests, so many questions. So tonight we are going to dive right back into it. But first, want to introduce you to tonight's guest for part two. We're talking about adolescents, young ladies. I know they're young men, young gentlemen, but we're focusing on the young ladies because in just a couple weeks, we will be hosting a lady girls church here in Austin for girls between 12 and 18 and their mothers. So we're going to dive into the things that some of the young ladies are dealing with. But last week we talked about mental health and we didn't get to dive into some of the other questions. So, welcome again, Deneen. Introduce yourself to those that don't know you. Tell us a little bit about who you are, your credentials, and where do you live?
Hello again, and I am so grateful to be back with you. It's really an honor, and I consider it a privilege to be in the same space with you, and definitely the fact that we are back for part two lets us know that this is definitely something we need to continue our conversations and discussions about. But just before we get to that, as you stated, my name is Deneen. I am in Tinley Park, Illinois, which is a southwest suburb of Chicago. Um, I have 25 years of clinical experience in behavioral health, master's in nursing and advanced practice credentials, also credentialed as a psychiatric nurse practitioner. I've taken care of patients across the lifespan, and I have such a passion for individuals who not only have diagnosed mental illness, but just those who struggle emotionally. So, emotional health is definitely a passion for me, helping individuals process those things, those everyday things that for some they can easily manage, and for others it takes them to that ledge. And for the few, there are those who jump off. So, we
Mm.
definitely want to get to them before it gets to that point. So I'm excited to be back again because, as we talked about last week, we talked about the pandemic bringing exposure to mental health and mental illness, but the pandemic is quote unquote over. However, we're still seeing a rise in mental health and mental illness. And in fact, I'm not sure if I mentioned this last week, but suicide is the second leading cause of death for those ages 10 to 14. Wow.
Wow.
At 10, I was still running around playing, right? I just wanted to
Mhm.
do my chores, do my homework, and go outside. But I can also relate to the adolescents that we're talking about today, because if you recall from last week, I mentioned the earlier that puberty starts, the more likely there will be these emotional or mental health challenges. And I was one of those ones that started puberty, at the age of 9. By the age of 10, I was already having a menstrual cycle. And yes, I was also one of those girls that unfortunately had to endure sexual abuse. And like most, I didn't tell. I didn't mention it until I was 40 years old. So I subsequently had to go through my own emotional struggles and make sense out of something that happened to me that as a child I couldn't articulate and was afraid to articulate because of the stigma, because of the embarrassment. And those are some of the reasons why girls don't tell. They don't want to be labeled, they don't want to be looked down upon. That's the age that you just want to fit in and be like
Mhm.
everybody else. So these continued conversations about mental and emotional struggles with our adolescents, we have to continue them because our society is evolving, it's continuing to change. The family dynamics changing, gender identity changing, all of the issues that come with social media changing, and it is wreaking havoc when it comes to mental and emotional health. So I'm grateful to be back again to have this second conversation with you.
Wow, you said a lot right there. One of the things that you didn't mention is that sometimes children or individuals will not tell because they have the fear that no one's going to believe them, or that perpetrator may have told them what they may do some harm to their family, or just, the idea that, like you said, they're ashamed, or they feel like they won't be, who's going to believe me? I'm a kid. They're
Mhm,
not going to believe me
mhm,
because there was an instance when I was very young, young married person, and a relative was dating a young lady who actually was sexually abused by the stepfather when the mom went to work at night as a nurse, and he sexually abused her. When she decided to come forth to tell the mom, ended up the mom didn't believe her, and she felt so betrayed because the way that it happened, the younger sister actually saw him because a girl shared a room, come into the room late at night and take her. And the younger sister said, "Where are you taking her?" He said, "Oh, she's going to sleep in our bed." And so that's when, and even though the younger sister saw that, when everything came forth, when the older sister decided, I think she was probably 16 at the time, when the older sister shared with the mom, and the younger sister confirmed what had been happening while the mom was at work, the mom didn't believe any of them. So instead, she to the children, well, in society, she chose the man over the children. She sent the children, 2 girls and a boy, to live with her mom and dad, so the grandparents, and stayed in the marriage with the man. So that's another reason, and that's another whole topic for another time, but that's one of the things, that who's gonna believe me? Because if, especially if the person was older than that person, which most of the time they are, that they're gonna, because even they said, well, if you tell, I mean, like, hurt somebody, do hurt somebody in your family, or who's gonna believe you? Because it's my word against yours. So that's, and so that's another thing, like you said, a burden to carry. And so that's another show we'll have to talk about, dealing with the abuse. But we,
absolutely.
but we've talked a lot about, you said, between mental illness, and there were two, a comparison you did. It was
Mhm.
mental illness and mental health, or what were the two that you were comparing it to?
Yes, I had mentioned last often we interchange mental health and mental illness, and people think that the same, but they are not. They have very distinctive characteristics. And a brief um, review: mental health. Think about mental health as a healthy mind, but mental illness is then a sick or ill mind. And so they are different, and they on a continuum. So you have mental health on one end and mental illness on the other. And all this, even without being diagnosed, we swing somewhere between the middle. For example, if everything is going well, you're probably with a healthy mind and a healthy mentality, a positive mindset. But then you lose a job, or you lose a family member. So some trauma, some crisis, some injury, some catalyst happens, and now you swing from health to maybe you only land in the middle. So you are sad, you're depressed at the loss, but not a clinical sadness or clinical depression. But if that sadness and depression continues and it lasts for, a year or 2 years, it continues, and now you're not able to function, now you have slid all the way to illness. So we have to distinguish between the two. And I also mentioned emotional health is different from mental health. So the emotional health is how you express your emotions, how you deal with and manage your feelings and your mood. And that can be both positive or negative, because you can respond in a positive manner to the loss. Yes, you're sad, you cry, but you understand that loss, hey, it's a part of life, and you grieve, but then you pick yourself back up and you continue on, right? So you slide back to that place of emotional health because you managed your mood and your feelings in a positive manner. But just say you don't. Now you're angry at God and you're angry at the whole world for your loss, whatever it may be. And now you can't function. You can't keep your job. You're not eating. You're not sleeping. Now you have slid to illness. So we have to keep those differences so that we know how to manage what we need to manage.
Wow, that's a lot. That's a lot.
Mhm.
And as a parent who's watching that has an adolescent, how what are the signs? How do we know? Because kids, have temper tantrums. They tell me, I raised sons, so we didn't really have the hormonal thing in that way where the girls I've heard say, "Oh, I hate you," or slamming doors. Plus, my husband, he wouldn't tolerate slamming doors anyway. Just one time, and that would have been enough. He's old school. But so how do I determine I have an adolescent, and how do I know? What are some of the signs?
So I also mentioned last week symptoms of illness or an issue, maybe not necessarily an illness, it can mimic just going through puberty. As you stated, especially with the adolescent girls, you have hormones all over the place, and physiologically, the brain is developing, and physically, the body is developing. And so you get the mood swings. That doesn't mean they're bipolar. They could just be moody with everything going on, that their brain still hasn't caught up with how to manage and articulate what's going on. So definitely the change in mood. Sometimes they isolate. Is that an illness, or is it just an adolescent behavior? That's where observation and conversation comes in. I shared that last week, because sometimes the isolation is that they don't know how to express what they're feeling and going through. So rather than make everybody else miserable, they will try to keep to themselves. But you have to keep eye on that, especially with social media, because children will isolate, and then they're on social media and all these various apps that now, along with dealing with their adolescent changes, their minds are being flooded with things that may not be reality. And social media, we know that's how predators get them. If they're feeling lonely, you can go on social media, and social media can make you feel real good. So even with isolation, you have to make sure that the social media and their computer is not just consuming their time, because that too is an addictive behavior. There
Mhm.
are adolescents, if you take away their devices, they become destructive. And we have seen evidence of that. So you have to observe and you have to communicate. There may be sleep issues. Either they sleep too much or they're sleeping too little. Doesn't mean it's an illness, but you have to pay attention to that. They can have changes in their appetite. They either eat too much or they're eating too little, but especially with girls, because eating disorders are more common with them, you have to watch for that. They may seem to eat normally, but then you have to wonder, are they eating and then they're secretly isolating so they can purge? So you have to watch for eating disorders. Then there are those somatic complaints. My head hurts, my stomach hurts. Oh, I don't feel well. And you ask them what's wrong. I don't know. I just don't feel well. Um, You'll have to look for risky behaviors, especially when they become very defiant and rebellious. Is that just teenage behavior, or now are they involved in other things like drugs, alcohol, substance use and abuse? Are they now in a gang? Because gangs have a way of making you feel important, making you feel included. So you have to look at all of those things. And when it starts to impact their ability to function on any level, now it's time to say, well, better safe than sorry. Let's get some professional help and let's just get this looked at, right? And even that can be a journey for parents. And before I go off into that, did you have any questions or comments about those signs and symptoms?
Yeah, that's a lot because you don't know. And
Mhm.
because you don't know, because I'm thinking of a young lady that I know, she started being really quiet. And I understand what you said about trying to talk to them or open up with them and getting them to open up. But oftentimes they will say, "There's nothing wrong," or "I'm okay." Um, so I don't know, you said if that didn't work, just to what, yeah, what I'm hearing is that you said to kind of watch their behavior, and if and then just keep an eye on that behavior to make sure that it's not purging or something else.
Yes.
But how long should this last? Or at what point I say, okay, this is not working. It's been 3 months now. The hormones haven't leveled out. Do I take them to an OBGYN? Do I take them to a therapist? Do I take them to the pediatrician? What do I do? Because, I've heard you say to watch them. Okay, I've been watching them. I don't see anything. I'm trying to talk to them. They're very reserved, saying that everything's okay and I'm fine. But I notice their grades are not. They're slipping in their classes. They just seem to be kind of in la la land, just kind of I drop them off at school every day. They seem fine, but they're not following through on classwork. Or
Mhm.
in the older girls, perhaps they're sleeping all the time. They're always, they come in, they, might eat a little something, but then they're in the room with the door closed and social media, or don't want to get up in the morning to go to school.
Mhm.
So what do I do? I've heard all the things that everyone's saying. I've heard what you said,
Mhm.
but they're still there. So the question is, how long should this last before I seek help? And then where do I go? Like I said, do I go to the pediatrician? Do I go to the OBGYN? Do I, try to get therapy, talk to the school counselor? Where do I go?
Yeah,
Who can help?
sure. And this is one of those things that there is no one size fit all answer, because every child is different. They go through puberty differently. They manage their emotions differently. So you can't say after 3 months, then do this, or after 6 months, because puberty can last for some years. Even after
Really?
the body stops developing, the brain still has to develop. But you said something. You said in the instance where they're saying they're okay, but now they're not doing well in school.
Mhm.
That's a change in their level of functioning. Where it becomes tricky is they were always doing bad in school. So them doing bad, you can't tell, are they okay or is this something else? Right? So you have to look at the areas where there is a change in a pattern of behavior, even in the relationship where they used to enjoy sitting down, for dinner with everybody. Now they want to isolate. And if you try to make them sit with everybody else, you have this whole blowout. That's a change. So you have to start looking for those negative and significant changes in behaviors and patterns. And when you see that, that is the time to then, I would say, start with your primary care doctor. You want to rule out, is there any abuse that has not been talked about? For example, I shared my own story. I was 10, but it was never addressed because, as you stated, I was afraid to tell because I was threatened, right? And so I didn't tell. Well, early on, the child can kind of mask what happened. But as puberty happens, and as now they start to develop some vocabulary to articulate how they feel, that's when now those feelings of anger and everything else comes up again. So you have to rule out, has there been any type of abuse, whether it was physical, whether it was sexual, or even verbal. And then the primary care doctor has to rule out medical issues. So a physical should be done, blood work should be done, things like anemia, diabetes, because adolescents, they can be diabetic as well, or even thyroid issues can mimic mood disorders and anxiety. So
Yeah.
you have to have the medical piece looked at, even looking at your own family history, right? Is there mental illness in the family? Because maybe you as a parent didn't get it, it can skip generations. If
Mhm.
it's in the bloodline, it can show up. So your primary care doctor can rule those things out, right? Even with the OBGYN doctor, they may also be able to rule out things to make sure there are no reproductive issues, even in their adolescence. But here is something, um, and definitely, I mentioned this, you want to rule out substance abuse, right? Because substance abuse will definitely change the mood and behaviors. And especially today, because our adolescents think, well, THC is legal. So they don't see it as an issue,
Mhm.
but it also leads to toxicity. Especially if you smoke THC, it's going straight to the brain. So changes in the behavior, it's more apparent. But if you're eating it like gummies and through food, because the effects are often delayed, now they're eating more because they still don't feel anything. But then once it kicks in, if you have too much in your system, now you can become anxious. Now you become agitated and irritable. Now you become paranoid, and all of those mimic signs of some type of mental issue, right? So even something like that, you have to rule out all those things. And there's a reason we talk about eating your fruits and vegetables. because vitamin and mineral deficiency also lead to mental health issues.
Wow.
With individuals with mood disorder, especially with our kids, low vitamin D. We see with depression and mood disorders. When we were children, we were outside getting plenty of sunlight and
Mhm.
vitamin D, but today they're inside, they're on their devices and computers. So, vitamin D in the clinic, we often see that there is a low vitamin D with those children who mood disorders. And I can go through the list of the vitamin B12s. They also have mood swings and paranoia and irritability. So we can just go through the list. So it's important to have the medical doctor. No, or I'm sorry, no medical issue going on. So if you rule out all those things and you rule out abuse and you rule out any physical, sexual abuse, then maybe we do have an issue.
Wow, that's good. Now going on to the older, because I know we're going to run out of time because there's just so much.
Mhm.
When we
Mhm.
look at the older girls say 16 to 18, by that time they're developing some personalities, especially if they're the only girl and sometimes the only child, or maybe even during that time they start to have tantrums or, those little fits or things. How do you tell in the older girls, because I know you worked in the clinics, how do you tell if they're faking an illness, to say, I just don't feel good, or the doctor says, for instance, at the medical profession, or they think they have bipolar or schizophrenia or something, but they think they have this or that. How do you determine if they're faking it or if
Mhm.
it's really a disorder? They just want to have their way. If this is just something they want to do, because my little sister, I have a younger sister, she tried having fits as a little girl. So I don't know about, some I don't know, your kids may have been perfect, but my son, my sons,
Absolutely not.
oftentimes you see little kids, if they don't get their way, they'll stomp their feet, might throw something or fall out on the floor. I remember my younger sister did that, and she's a lot younger than me and my brothers, actually 10 years younger than my brothers. And so by that time, my mom was all educated because she was a nurse and she was different. We fell out. Well, for one, we didn't fall out. If we fell out on the floor, you only fell out one time because she was gonna help you up with some help with the belt or something.
Right.
But by the time my sister came along, I remember, because I'm 13 years older than her, so I remember her at 3 or 4 years old, having a temper tantrum, stomping her foot because she couldn't get what she wanted. And my mom was like, "Oh, that's okay," because she went to, a therapist, and they said, "Okay, it's okay for her to express herself." And so my mom was letting her do, have stuff she wouldn't let us get away with, acting up. But that one time, she acted up in a store, like a Walmart. We had a local little five and dime store, and uh, my mom forgot all that the therapist told her because that girl fell out on the floor, people looking at her. And my mom, yeah, she forgot what the therapist told her and she went back to the old school way. So it started out as a young person, and I can remember as she was getting older, she would have her fit. They weren't as bad as was when she was little because she knew better and she knew that,
Mhm.
she knew the consequences. But say you have an adolescence that, this it started out little, because my sister started out as a little girl, and she's still, the person's still exhibiting some of that behaviors, or the parents are just, oh, go to your room, or I'm gonna take something away from you. But this has gone on for a while, and now with all the buzzword about mental health, mental issues, and the parents think, "Oh, maybe my child does. Maybe there is something wrong." On my husband's side, we did have that relative that they just kind of kept in the room when we go visit. Oh, that's just cousin so and so back in there. He's different. They would say, "Oh, he or she's different." And or someone could be like me. Google's my friend. I'm looking up stuff all the time on Google.
Mhm.
You choking. Let me see what Google says about choking. But those that know me and Google, okay? And
Mhm.
so now this child she's a young adult.
Mhm.
She's 16. She's still slamming doors, or it's magnified now. And I'm thinking, well, maybe she did get that from that side of the family. Well, because a lot of times I would blame stuff on my husband when one of our sons would be acting up at school. I'm like, I don't know where he get that from. I'm like, he must have been a bad little boy, and you just didn't tell me. So I'm trying to my voice of reason, trying to see who did he get this from. So in that case, the mom was like, well, I don't know if it's really something wrong with her, or this is just she's just being a brat. So how do you determine, or how would you know if this is really something wrong? After the medical profession said, "Oh, the counselor at school said you think your little girl now. We believe she's got some mental disorder," and so, and so, but then on another side, she's know how to fake it to get what you want.
Mhm.
So, how do you tell? Where's that fine line? How do I know as a parent that she didn't take after my husband's side, that person that's in the room, or or she just being bad, and she's too old now for me to spank her. So how do you know?
And that is where the challenge is. It can be so difficult because, as you stated, in the late teens, young adult, now they have the vocabulary and can Google themselves. These
Mhm.
are the symptoms of anxiety. These are the symptoms of depression. And I remember I was seeing adolescent girls in a residential facility. And when I tell you, they sharpened my skills because they would literally, come in for a session and would be like, I need this medication. They could tell me the name, tell me
Wow.
what it was supposed to do, and tell me the symptoms they had. But here was the issue: they were almost repeating Google or the DSM, which is the Manual for Mental Illness. They're saying the wording verbatim,
Wow.
or they have talked to their peers and others that's in the facility with them, who tell them, oh, this medication work wonders and they'll give it to you if you act like this. So, all of that being said, it is very difficult to tell, and you go back to the process of elimination. If they've had the physical and they've had the blood work and there's no medical issues, there's no history of abuse, or if you find out that there was abuse, now it is potentially, now they're acting out over the abuse that happened all those years ago. But
Mhm.
you have to rule out all those things. You have to rule out the substance abuse. You have to, peel back all those layers. And if nothing else is there, now let's look at, there is most likely something going on, especially in light of there's nothing else going on and you still choose to act like this, you still choose to say what you say and do what you do. Well, maybe there is some personality or some other, condition going on. Yeah,
Wow.
and they do have screenings for all of that. If they're saying they're depressed, they have a screening for depression. They have a screening for anxiety. They have a screening for bipolar, for psychosis, for ADHD. And that's where the healthcare provider can then do that screening and kind of come up, yeah, more than likely, probable, or yes, we believe this is what's going on. They have psychological testing. So there are ways to get to the bottom, but our older adolescents, they are sharp in terms of getting the information and mimicking what looks like an issue when they just don't want to do what they should do.
Mm-hmm.
So it's difficult with the adolescents, absolutely.
Yeah, could be very manipulative. Um,
Mhm,
so my last question, since you are Janine, but you're also a minister of the gospel,
mhm,
and one of the things that and we talk about is trying to determine as a religious leader how to determine, is it spiritual or is it really physical? Because is mental health, is this, like you said before, is it a mental health or illness, or is it a spiritual that with some other entity that they've been dabbling in that have opened up doors? So how would you determine? Because I know in the workforce, you are clinical. You have to identify it according to the clinical reports and, like you said, the measures in place. But from a spiritual standpoint, what would you tell the leaders that are Christians that are watching it, that are believing Jesus Christ, how to determine whether it's physical or really an illness that is not spiritually connected, because that's a new
mhm,
thing, new to me, that we see different workshop and seminars that teach mental health first aid and how to identify mental health emergencies in a congregation or in an Ephesus. So
mhm.
that's the clinical side, and you are a minister of the gospel. So, what piece of advice would you give those leaders that have heard the clinical side but want to understand that what it is from the spiritual standpoint?
And even there, and that is so good that you brought that up, because we are triune beings. We are spirit, we are soul, we are body. In our soul is where the mind is, those will and emotions, right? And all three affect one another. So how we are emotionally affects us spiritually and physically. How we are spiritually affects us emotionally and physically. How we are physically affects us emotionally and spiritually. And so the dynamics, again, there is a fine line, but as addressing it from the spiritual standpoint, and we know all of it has a spiritual foundation, but even before you can get to it spiritually, you have to deal with what's going on in the mind. So
Mhm.
you still have to rule out, is this medical? Is this abuse? Is this a deficiency of some sort somewhere else? So that then you can also address it spiritually. And in truth, this has been documented. Those who have some type of religious or spiritual faith based background, it is a great coping mechanism. It helps with resilience. It helps bring them through what they're dealing with, both from the mental and emotional side as well as spiritually. And unfortunately, in our Western culture with medication, they try to separate the two, and you can't. And I know that was not a you got to do ABC answer, but it still goes back to it's really a process of elimination. You deal with what is going on in the mind, what's going on emotionally and mentally, and you address the spiritual aspect at the same time. Yes, you pray.
Wow,
Yes,
that's good.
you
That's
put
good.
the word on it.
That's good. That's good. Yeah, and as you were talking, I was reminded going back to the medical piece, um, a former coworker's little boy would act out at school. He was acting out, just I mean, just acting out. Come to find out, like you said, the family started going through the process of elimination with testing first. They found out because, like you said, different foods, going back to what you said, the foods or deficiencies or different things, kind of like when you talk about people that have the peanut allergies or the fish allergies, things like that. Maybe it's breathing or hives or something. But in this case, this little boy was acting out. Come to find out, he was allergic to red dye. All the foods that had red dye in it, it altered his mental state. It altered his behavior. It was like you had given him something, some type of stimulant, but it was a stimulant because it was the red dye. But
Mhm.
they had to spend extensive time going through the process of elimination by doing the blood tests, the allergy tests, things that you wouldn't even think about doing to find out he was allergic to anything that had red dye in it. So this is like you said. So one thing that you said is that there's not one solution. There's not a solution. Me who won't can you give me that one solution? No, there's not one solution. That means that as a parent, as a caregiver, I have to go through a process of elimination. And I heard you say observation, observing that person and their behavior, all types of things, even monitoring what they maybe in tune to. Are they all of a sudden in their room on YouTube or one of the social media sites? Just like you said, observation, and then you go through the elimination, whether like you said, the different testings, the doctors, all of that. And so it's like for me who like they say, I'm from, we're nowadays from the microwave generation, that it's not a quick fix. It's
No,
not a that it's and it can be weary. I know as a parent trying to figure out disciplinary uh what works as far as disciplinary actions for one child compared to the other, and why taking away or spanking or whatever. So that's what I see as far as the mental aspect of it. This has been so good. I appreciate you so much for coming back on because they had a lot of questions from last week. So, what do you recommend as we get ready to wrap up tonight? Someone that's listening, they, whether they're a caregiver or have a friend that's having a problem, is there a particular website that you can refer them to as a start? Because thankfully individuals watch the broadcast and the replay from all over the world, but specifically here in America, where can someone go that don't know what to do to get started? Where can they go to? And by that, possibly even maybe getting some free services or something. But where's a good place for someone to start?
definitely, I would say starting with NAMI.org. That's the National Alliance on Mental Illness. And I say start with them because they are national. I'm here in Illinois, you're in Texas, so different states have different resources, but because they are national, they can definitely direct you to free resources because most states, most regions have available also free resources for individuals with emotional and mental illness. So that's a place to start. Also, start with your primary care provider. They can also connect you with social services. Most states have a social service department somewhere, and they can also connect you with resources to assist you. And I think I also gave last week the Substance Abuse Mental Health Service Administration. That's also another organization that they can also get information for. And I would just add this lastly too, when it comes to adolescents and constantly saying they're okay and not wanting to see the doctor or go to therapy, then as a parent, sometimes go to therapy alone, because that can help you then manage your emotions so that you can see clearly, and they can give you tools and resources as well. And instead of then recommending your child get therapy alone, say, hey, as a parent, I see things like this. I want all of us to go. Start with family therapy,
Good.
and then the child won't feel so isolated. So those are two things that I would recommend.
That's great. So if someone wants to reach out to you again, thank you. You have, your name is Deneen Anderson, um, all the way from Chicago. I called her my partner in crime.
Yes, yes, we are.
Yes, yes. So if somebody want to connect with you, how do they connect with you?
Yes, they can email me at timeforliberty7@gmail.com, and they can ask whatever questions, any inquiry, and I'll get back to them, and we can go from there. If they're just needing resource information, I can definitely give them that information through the email. So timeforliberty7@gmail.com. And that 4 is FOR, not the number.
FOR. Oh, okay.
Mhm.
Okay. Well, thank you again. I want to thank you again. I've taken time out of your busy schedule to come back on this week. I
My
hope
pleasure.
Yes, I hope she answered the questions that individuals like, okay, she didn't get to answer this, and this. So I brought her back. So prayerfully, you got your questions answered. If not, reach out to her. Like I said, reach out to her. She's a consultant. She has many years, several years in this industry, and she can help point you in the right direction. So just want to thank you again, Deneen, for coming on, and thank you guys that are watching in the replay. Get ready next week because this month we're focusing, like I said, on girls because we're getting ready to blow up in Austin and at Girls Church on August the 3rd. So if you have any questions about Girls Church, by all means, reach out to me. We want to pack out that place, bring your girls 12 to 18, moms. You want you in the house with your daughter, you're the caregiver. Just come on down. Like I said, make it a girls' trip. Make it a weekend. Austin is a pretty place. It's warm, but it's pretty. So once again, I want to thank everyone for watching and see you next week. Have a good night.